Good morning. Today I shall be talking about dysregulation of melanogenesis pathway in uveal melanoma. Uveal melanoma is the most common intraocular malignancy in adults. It arises commonly from the choroid and then from ciliary body and iris. Metastasizes mainly to the liver, and this is the cut section of eyeball showing a choroidal melanoma. Now, there are several clinical and histopath high-risk factors in uveal melanoma. Pathological factors like large tumor diameter more than 15 millimeters, epithelioid cell type, these are the epithelioid cells with prominent nucleoli. Hyperpigmentation, ciliary body invasion, scleral and extrascleral invasion, and this is scleral invasion, tumor infiltrating lymphocytes and tumor associated macrophages. So, hyperpigmentation or increased pigmentation in uveal melanoma generates immunosuppressive and mutagenic intermediates that boost tumor growth, and high melanin levels promote their spread and increase resistance to chemotherapy and radiotherapy. Hyperpigmentation also contributes to hypoxic conditions and associated with distant metastasis studied in cutaneous melanomas. Now, hypoxia-inducing factor HIF1 alpha regulates the tumor environment in the presence of hypoxia. MITF or microphthalmia-associated transcription factor binds to HIF1 alpha promoter and stimulates its transcriptional activity. So, high expression of HIF1 alpha has been seen in many cancers, including uveal melanoma, but importance with pigmentation has not been studied. So, we aim to explore the crucial role of MITF and its association with melanogenesis markers TRP1, TRP2, SILV, and HIF1 alpha in uveal melanoma. So, fresh tissues and formalin-fixed paraffin-embedded sections of 82 uveal melanoma patients and 15 normal choroid samples were taken as controls, which was collected over a 4-year period. Immunohistochemistry and real-time PCR were done to see the expression. So, these are the demographic details of the 82 melanoma patients. As you can see, 72% patients were more than 40 years, and there was a male preponderance, and high pigmentation was seen in 74% of cases. Distant metastasis was seen in 9 cases, of which 3 patients died. Follow-up was there for up to 48 months. So, we also did the pigmentation grading. We did the clinical grading, which I have not shown over here due to time constraints, but pigmentation grading was done on light microscopy, and less than 30% was taken as low pigmentation and more than 30% was taken as high pigmentation. This is the picture showing highly pigmented uveal melanoma. So, we studied the immunohistochemical expression of these melanogenesis markers, TRP1 and TRP2. Both of them, 48% was seen in high pigmented UM, and TRP2 was seen in 59% of high pigmented UM. SILV protein was expressed in 70% of high pigmented melanoma cases, and MITF had nuclear expression, which was expressed in 56% of high pigmented uveal melanoma. HIF1 alpha was also overexpressed in high pigmented, around 48%. So, we studied the association of TRP1 with clinical path parameters, and as you can see, the statistical relevance was seen with large tumor diameter, clinical TNM staging, high pigmentation with TRP2. With SILV also, it correlated well with clinical TNM staging T3, T4. Nuclear MITF also correlated with high pigmentation, and HIF1 alpha correlated with large tumor diameter, high tumor staging, high pigmentation, nuclear BAP1 expression. mRNA also showed increased expression with MITF in comparison to normal choroid, along with SILV, which also showed a fold change value of 4.2. So, Kaplan-Meier analysis for all the markers is shown over here, and they all showed metastasis reduced free survival, which was reduced with all the markers, but nuclear MITF showed statistically significant with metastasis-free survival. So, to summarize, high expression of melanogenesis markers TRP1, TRP2, SILV and MITF were found in all high pigmented UM cases, both at the protein and mRNA levels, and Kaplan-Meier showed reduced metastasis-free survival in 82 and 86% of UM patients with TRP2 and SILF, but among all the markers, it was MITF which was statistically significant with reduced metastasis-free survival. On multivariate analysis, MITF expression came out to be an independent prognostic parameter, and melanogenesis pathway contributes to hypoxia in uveal melanoma, and high pigmented cases correlated with increased HIF1 alpha expression. So currently there are no direct inhibitors for melanogenesis markers. We need to do translational studies further, and this may pave the way for new targeted therapy. Thank you.
Very good.
Good study, actually.
Thank
Good
you.
study.
How many cases you have done? Around 80%.
These were 82 cases that we had collected over 4-year period.
And how many follow-up, follow-up anything?
Follow-up was for about 6 to 48 months. That was the maximum follow-up.
What was the period of study?
4-year period,
Yeah, when?
2018 to 2021.
You have a infrastructure that grows
Yes,
facilities.
yes, we have a lab.
Thank you.